listeners that have tuned in to Albayan live. We are here for the pharmacy hour with pharmacist Saeed Al Khodary. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum assalam wa rahmatullahi wa barakatuh.
So, for those that are tuning in for the first time and that have not, subhanAllah, tuned into the program before, who is Saeed? Other than being a beautiful brother, who is Saeed?
Well, I'm a pharmacist. I'm 40-something. I've been a pharmacist for since 1998. 1998. So yeah, I love it. It's awesome. Been here in Greenacre for nearly over 20 years now.
So you've got the golden arches, which is known to be McDonald's. You've got the golden chairs.
That's right.
Which are renowned in the pharmacy.
Yes.
Even when you moved, subhanAllah, you took them with you.
That's right.
Your discount chemist. Prior to that, it was just called Khodary Pharmacy. SubhanAllah.
Yeah, those chairs. My dad is a Najjar and Najjar. I can't remember how it is in Egyptian, but he used to carve chairs, like the patterns on chairs. So
he made those chairs.
Yeah, he would. Well, the ones that you're referring to, I think they're gone now. They've been used too much. But yeah, that's what he used to do for a living. So some of those he made. Yeah,
I remember they were just the standout things. SubhanAllah.
Yeah,
and when you moved, I remember they were there for. I don't know if they're still there, but SubhanAllah. Very important, Saeed. And for those that don't know, my name's Omar Najjarine. I've become part of the furniture in these last couple of weeks to Albayan. Not as much as Abu Abdurrahman and our other brothers. We're going to be speaking about, obviously, COVID vaccine.
Yes.
What is a pharmacist? That's something very important. I just want people to understand. The doctor is the one, obviously, that prescribes the medication. The pharmacist is the one that dispenses it. But the pharmacist is pretty much the one that has deep knowledge about the medication, the side effects, the contraindications, the drug interactions.
Yes.
He's pretty much the one checking and giving the approval to the patient, saying, yes, this is what you're going to take.
Yes.
And 1, 2, 3, 4. At the same time, pharmacists do see patients.
Yeah.
They do write certificates for health certificates and so forth. And soon being they're also administering the COVID vaccine.
Yes.
So pharmacists obviously play a very, very important role.
Yeah.
So what's the job of a pharmacist?
Okay, so basically, if we look at the doctor and the pharmacist, doctors are the experts in diagnosing, what might be wrong with you. So that's where a lot of their fortes. They know about medications as well. So, but we as pharmacists, most of our learning is in the actual to get deeper into the toxicology of molecules and things like that, but just more information about the molecules, what they do, how they work, and their side effects and ill effects and things like that.
And pretty much are responsible for overseeing the patient through his administration of medications.
And any issues they might have and that kind of thing. And then when there's issues, we might liaise with the doctor as well and let them know.
As we know, there's a lot of talk, a lot of things happening at the moment.
Yes.
And we find that, normally when things don't have attention, most people accept them to be fine. They put their trust in, we call it the system,
yes,
to say, that it will not harm them. And so when we take a lot of the medication, we never really ask, other than we take the script, we get the medication, we ask a few questions, how much do I take, whatever, what do I look out for? And that's pretty much it. We don't actually get into the details. Like when people are taking certain medications, how many people actually come and say, what are the ingredients? It doesn't really...
Not very often, no.
People don't really ask that, or they want the details or whatever. All that stuff is available online, but most people know doctors prescribed it. They put their trust in the doctor. The pharmacist has prescribed the medication or dispensed the medication to them, has given them information, has checked the patient's other medication, make sure no interactions, has said, you're fine, you're okay.
Yep.
Other than that, the person takes the medication and life goes on.
Yes.
But when there's a lot of misinformation out there, people start to get confused. And you find that a lot of people, they lean more towards the hate information. So I get something has to be a villain. You know what I mean? There's always
Yeah.
a superhero and a villain. In this case, the villain is starting to lean more towards the vaccine and vaccines in general. What are vaccines? Where do they come from? Where do they exist? I have a bit of background in public health. I did start a master's in public health, and in that was touching a lot about how vaccines changed the world and how previously, before the 90s, a lot of people were dying from infectious diseases.
Yeah.
Chicken pox, measles, malaria. That's sort of changed now.
Yep.
Majority of people are dying from diabetes, which are non-infective diseases.
That's right. Yes.
And that's because of vaccines. What are vaccines? Give us a little bit of insight. Why do we take vaccines? Why is it important? How's it changed the world?
Yeah, well, vaccines, they're something that we put into our body that try to basically warn or teach our body to fight a disease when it actually comes. So, I don't want to, if we use technical terms, that it develops, makes your body develop some antibodies. And these antibodies, they're like the little fighters you have in your body, and they remember things. So they remember the look of that particular bacteria. So when it comes back again, it knows it fights it. And same with viruses. Viruses are much more difficult to actually treat and get vaccines for because they change their shape or they change their protein, and it makes it much more difficult for it to be beaten by a vaccine, if you like. But in very simple terms, that's what a vaccine does. You put it in your body to try to forewarn your antibodies that, look, hey, this is, if you see this again, fight it.
So it's pretty much, it triggers the body's response.
Correct. Exactly. Yeah. Yep.
Would you say like putting in a CD in a computer, uploading a program, so that now computer has that extra information? Pretty much, you're doing the same.
Yeah, pretty much.
Same thing.
And then so when it sees something, when the computer sees something that, oh yeah, I've seen you before, I'm just going to knock you out. That kind of.
So the vaccine is not what's killing the virus; it's what it does to the body, in the form, and the body does that naturally, but not too well when it comes to viruses.
Correct. Yeah.
And it's just helping the body focus on these viruses, on this sequences or whatever it may be, to say, okay.
They have the viruses have what they call spike proteins. So they're like they're just a protein, a compound that sits on the virus, and that's how the body will recognize it. So what the vaccines do, they copy that protein.
Yeah.
Or in there's two different types of vaccines now we'll discuss later. But let's say that it recognizes that protein, introduces it to the body. The body recognizes it, and then fights it for when it actually does happen. So the vaccines they're not live vaccines. So there's no virus in the vaccines. They can't multiply as well in your body. So they're just
programming your body to.
Yeah, it's just basically recognizing it, getting your body to recognize it so it can fight it if it actually does come to you. So
obviously now more and more of anti-vaccination programs and propaganda and so forth is really sort of being pushed out there, and a lot of it is based on misinformation. At the moment now, with COVID, it was called COVID-19 because it did start at the end of December.
Yes.
Just give us an insight. Where are we now? And the second is COVID new? Is this something new? Is the coronavirus, is it something that's we've seen in the past, or is this is something unique? Like, where are we at? Where are we going?
All right. So, well, as of yesterday, there was 194 million cases of COVID since its first outbreak, with 4.16 million deaths. So that's about a 2% mortality rate, which doesn't sound very high, but it's probably higher because I can almost guarantee you some governments aren't reporting properly.
Would you say maybe probably less too?
Yeah, well, it could be less as well. It's
who knows.
Look, we can only go by what governments are reporting.
But it's not like Ebola, which is like 95% death rate. It's not like a person catches the disease and is dying straight away.
No, not at all. But still, 2% is still 10 to 20 times higher than the normal influenza mortality rate that we would have. So that it's still pretty potent compared to the influenza that we get seasonally. So in terms of COVID, we have seen something similar. It was in Saudi Arabia, in the Middle East, where there was the MERS, the Middle Eastern SARS virus, I think they called it. Respiratory. So that was a form of a.
So that was a COVID.
A
virus.
Coronavirus means.
I think it was from SARS, and it turned into.
A coronavirus in general means.
So swine flu is a coronavirus.
From an animal.
Yeah.
Animal.
AIDS would be if we believe AIDS did come from monkeys. HIVs would be.
I'm not sure about that because it's called corona because the way the spike protein looks like a little.
But it's not. It's like pretty much not the first one. There's been other coronaviruses in the past.
There's definitely been other. Bird flu was earlier, and then
swine flu,
and then now
SARS. And I remember like with the MERS virus or MERS virus,
it's Middle Eastern respiratory syndrome or something.
I remember that time we were going to Hajj and we had to take the vaccine, and I don't remember anyone even questioning. Okay, they went got the jab. That was it.
Yeah, well,
life went on. You know what I mean?
Almost guarantee you're going to need to take the COVID vaccine to go to Hajj as well this year.
To do pretty much anything.
Pretty much.
So, in general, benefits of vaccination, because I had an argument with someone, and listen, if someone doesn't want to take the vaccine, don't take it. In Islam, if you want to refuse treatment, it's up to you.
Yeah.
You know what I mean? The concept that there's someone that's injured and you want to go up to him, help. If he says, don't touch me, you don't touch them. If he doesn't want help, you don't help them. Likewise, if, there's a treatment and you don't believe in it or you don't want to take it, that's fine. We've heard people refusing chemotherapy because they think, they don't want to they want more quality of life than quantity, whatever. Right. That's fine. But that doesn't shy away from the fact of a lot of diseases now don't exist because of vaccination.
Yes.
And it doesn't shy away from the fact that, someone said, my kids are not vaccinated and they never get sick. Okay, well, because all the kids they're hanging around are vaccinated.
That's exactly right, yeah.
But put him in a scenario where other kids are not vaccinated and the general... Because what they said, what spreads the disease is three things. One is hygiene, personal hygiene.
Yes.
Second is the sanitation or like in Europe, they have open sewages.
Yeah.
Where, the sewage will just run and there'll be, rats and everything, you know what I mean? And that's what spread the swine flu.
Yeah.
Or plague during that time.
Yeah.
And third is people's lack of attention to health and medical aid. When you don't have these three things, things can explode. Things can get really, really bad. And so people say, we're not getting sick. Oh, well, because we have these three things. Doesn't mean your child is fully protected, because there's a big difference between if someone gets COVID and there's a medication as a cure and a vaccine. They're two different things. One's a cure, one's a prevention.
That's right.
And so when you're preventing it, eventually it dies out. Is that what happens with the virus?
Well, it starts to not be able to find a host. So the human is the host. So if everyone's vaccinated, then all of a sudden there's nowhere for it to go. So
ends up passing away.
So it ends up just or being never completely goes away. It's like viruses; they're always around, but you just don't. If there's not enough people, if everyone's vaccinated, well, it's got nowhere to live. So
measles, when last person had, there could be one case.
There's a few cases here and there. Yeah, there's still a few cases.
That's about it. Yeah. SubhanAllah. Okay, we're going to get a little bit technical. Vaccines, what's out there? Cool. What brands? What do they differ? Why are people getting into these ingredients, saying, it's got that ingredient. Yeah. And you find that, I'm not going to put that in my body. And at the same time, they're smoking. At the same time, they're taking drugs. At the same time, taking cocaine and heroin and meth and all that type of stuff. It's like you tell someone that's got battery acid, they're like, so what? Yeah. They give exceptions to everything else.
Yep.
Give us a little bit of insight into the different vaccines, what's out there. sort of enlighten us in regards to ingredients and to what I know, to what I remember. When I was studying pharmacology at school, we had 1 or 2 modules of pharmacology. Is that sometimes some of the ingredients actually sound scary, but really they're nothing.
Yes.
You know what I mean? Yep. Some of them sound like they say, ethanol. Like you think ethanol. Wait a minute, I filled up my car. That means it's something to do with the petrol. But when you're talking about medical OH alcohol, it's different to when you're speaking about petrol that you're putting into the car. And you're talking about,
of course,
2 completely different things.
Yes.
And I think that what throws people off. So
yes, 100%. So all right, so we look with the whole the primary benefit of vaccination is to prevent from illness, and in particular severe illness and death. So there's 2 main brands that we have in Australia at the moment. So there's the Pfizer brand and the AstraZeneca. So the Pfizer one has been shown to be about 95% effective against the symptoms of COVID-19, and the AstraZeneca one, its efficacy is about from 62 to 70%, depending on how long you wait in between your doses of the first shot and the second shot.
Because Pfizer's one shot.
No, they're both
2 shots.
They're both 2 shots. They're both 2 shots, but they are 2 different vaccines, which I'll get to in a moment.
And that's common. Some vaccines, like I remember, I think it was Hep B, is 3 shots. I think.
Yes, that's more about boosters and making it last a bit longer.
But it's not uncommon. I need to have 2 shots.
But these are actually two different vaccines in how they're actually made and how they're generated. So now I think someone had sent through a question and about whether you can still catch it. You can still catch COVID if you've had the vaccine. So there's no it's not perfect.
So you're saying 60 to 70%
for the AstraZeneca.
So out of 10 people, for example, 3 may still catch.
Correct.
And for the other one, 1 out of 20 may still catch.
That's right. But in saying that, with both of them, almost over 90% of not getting of death, like you reduce your risk of death or hospitalization or serious illness.
So it might show up in your test results, but really it's not going to hit you as hard.
Yeah, totally. That's exactly. And that's the main thing that vaccines will do. So some people, now you can get a chickenpox vaccine. Some people still get chickenpox.
So really...
but it's very, very... Like they don't even get... Some kids will get the chickenpox vaccine and they'll get... I've seen maybe once in my 20-year career of someone who's had the chickenpox vaccine and then they got chickenpox. But the chickenpox, you could hardly even see it. It was like less than a speck on their body compared to what you would normally find. So these are the kind of things that happen when
But if you're saying that it's about your body fighting it, that means even if it has to have a point of entering your body, being active in the vaccine, or your body pushes it out. So
exactly.
In that phase, you might get a little bit unwell, but that's
so
something you may even not even notice.
Yeah. Whereas without it, you would definitely notice it. So there's 2 different, as I mentioned, there's 2 different vaccines. The Pfizer style, which is a new style of vaccine. This is new, we haven't had a vaccine like this before. It's called the messenger RNA vaccine. So how it works is it contains the genetic code for an important part of the virus called the spike protein, which we were mentioning. And the vaccine uses a new technology to induce immunity. So the messenger ribonucleic acid, or that's what they call the mRNA, is a genetic code that has all the instructions used by living cells to produce proteins. Okay, so what happens is the ingredient then makes copies. It tells your body, look, make some copies of this protein, which will develop the antibodies, and then your immune system recognizes it, and then if the virus comes, it fights the virus. That's how it is. Now, the genetic code after that is broken down quickly by the body.
Yeah.
Look, this is one that It's a new one, and this is, I know people have some fears about this. There's some about, the DNA, it changes your DNA. It it can alter your DNA and all these kind of things. It doesn't get into your DNA. It just tells your DNA what to make.
So you're not going to wake up as Hulk.
Look,
That's not
I'm
gonna
sure if
happen.
you're going to wake up the Hulk, I'm sure people would say this and, all right,
Some people
fine,
wanna-
give
some
it to
people
me.
wanna be
I want
Hulk.
blonde hair
Some
now and I
people-
want
some
blue
people
hair. People want the Hulk. They won't have to use steroids anymore.
See? SubhanAllah.
So it doesn't. A big misconception is about alternating your DNA. It doesn't alternate your DNA. It just helps. It just tells your DNA what to do, what to make. So it's new. It's a new technology. And look, it's started with vaccines. And
And do you want to say like Pfizer is a very reputable, like respected, known pharmaceutical company
correct
around the world, and the majority of medications that a lot of people take, a lot of them are branded, but the actual one, the maker of those brands, is Pfizer.
Yes. Yeah.
Um,
Look, there is again. I know there's rumblings about Pfizer because they did cop the third highest fine ever in America from the government. They did get in 2009, I think it was, a $2.3 billion fine for illegal marketing of a few of their brands in America, where they were paying doctors to prescribe what they call off-label uses of things. Look, that's yes, that's true that they did do that, but that just because they did that, it doesn't mean that their vaccine is something wrong with their vaccine. So I mean, companies, big companies like that, of big corporations, they have a lot of people that run that place. So what each individual person is getting up to isn't always known by
things can go wrong.
Look, I'm not defending big pharma, but I'm just saying that lots of pharmaceutical companies get fines, and just because they have, it doesn't mean that the vaccine they made is something wrong with
or
it.
the medication is not.
Yeah.
Not good.
Well, I'm pretty certain that most of Australia has taken Lipitor.
Yeah, and that's
Well,
isn't that the most prescribed
It
medication?
was up until about a few years ago. It was the biggest prescribed medication in Australia, and made by Pfizer for cholesterol, and absolutely no problems with it whatsoever. It was actually a blockbuster drug that they were one of the biggest blockbuster drugs of the last 20 years because it saved so many heart attacks by lowering cholesterol so effectively. So, so look, yeah, they have had fines, but just because someone's done the something wrong once doesn't mean, well, that's it. Everything's no good now.
And it's more, you said, more towards a marketing issue. But at the end of the day, like with any, I guess, big company, not everyone knows what the different levels of them are doing, and all it takes is the smallest thing that can that can sort of,
like I said, I'm not defending big pharma, but at the end of the day, they've also, if we look at medication in general, whether we like it or not, it's prolonged people's lives and help people with all sorts of things. Look at antibiotics and all these kind of things that have been invented by companies. I mean, they maybe don't have the best reputations, but they have helped. And AstraZeneca, for instance, the next vaccine we'll talk about, they're actually not even profiting from AstraZeneca. They are doing it non-for-profit from the vaccine. So, there's no real, okay, so if they're not profiting from it, then what can you say against that?
Yeah.
It's anyway. So the AstraZeneca one is the older, what I call the older style vaccine. So that's produced. That is produced typically how all, like most of the other vaccines that we know have been produced, and it's this vaccine. It's again no live virus, so it can't give you COVID-19.
None of them are live, yeah?
None of them are live. No. There's not many live vaccines anymore. I can't remember which one. There's only one that I know of, but it's very, very not very common. Yeah. All of them are pretty much like this one, what we call the Adenoviral vaccine. So what happens is it gets the code, the genetic code from the spike protein, and it's inserted into a harmless common cold virus, which they call the adenovirus, and then they bring that into the vaccine. And so what they do though before they do that is they make sure that the common cold virus, the adenovirus they put in, that it can't replicate in your body. So it just goes in there. It has the proteins. The body recognizes it, but it can never multiply.
Like I asked the chemist once, or someone used to work for pharmaceutical company. I would say to him, like, medications in general. I go, where do they come from? He goes, they all come from the earth. He goes, they all come from the earth. Nothing.
Yeah.
Where else are we going to get it from? Space. He goes, but what we do is we look, for example, at a certain type of mushroom. We go and we try to find the actual active ingredient or active protein within that.
Yes.
We extract that.
Yep.
We find the mechanism to be able to administrate that to a patient, and at a certain dosage that can benefit them, but not so much that it harms them. You know, like a window of, you know,
the
treatment.
what they call the therapeutic window. Yeah.
And that's pretty much it. So we're not sitting there inventing. Everything comes from something.
Yes.
He goes, if you want to go back thousands of years ago, they would break herbs down, they would break certain things down, and they would give them to people. Like, I remember I met a brother who was doing his PhD, and among it was about kidney infections and Staph aureus infection. And he said, surprisingly, he said the best product to fight this type of bacterial infection is honey. And now they actually use it on wounds. They're called honey.
That's right. Yes, that's right.
He goes, but what we're trying to research, the problem is that we have not figured out a way how to extract certain proteins, whatever, from honey and actually put it into the bloodstream. You can't inject someone with honey.
Yeah.
But we know that honey has antibacterial properties.
That's
and
right,
will
yes.
stop the growth of Staph aureus.
Yes.
But to administer it into the blood on superficial, it's amazing.
Yeah.
But into the blood system, because this is the bridge that we can't figure out. So at the end of the day, everything comes from what's around us.
That's right.
Really.
Yeah.
So up to now, there's been so many people vaccinated. So
Yes. I mean, let's talk safety. So, you know,
what's a normal study? For those that don't know, a lot of things are research articles. You got to pay to access them.
Yep.
In university, that's what you study, and they're called, you know, randomized control trials.
That's right. Yeah. Double-blind randomized controlled studies. Yeah.
With placebos and all that stuff.
Yes.
You know what? If you want, look into that. It's very complicated. But there's always the sample size. I always talk about the sample size.
Yeah.
For medical, a sample size always can be from 100, depending, because sometimes you have to find a person that has that condition. So, for example, if you're testing lepra, you spoke about lepra.
Yep.
You have to find, we got to find these type of people in different age groups, men and women, possibly a pregnant person, that has cholesterol,
different races,
and that's hard to, and have them agree to take it and to be monitored.
100%. Yeah.
And so you can have a sample size of 100 people all the way up to thousands of people.
That's right. Yeah.
So how do we relate that to now?
Yeah, well, so if we look at this, so so let's just put it in this way. As of late April, there was more than 1 billion, that's a B, billion doses of COVID vaccine given.
That's a big sample size.
That is huge.
Even if experimental.
We're talking about 1 billion.
Like 1/6.
That is huge. So, you know, when you research, when you want to do like you're saying, a clinical trial, I think the Pfizer clinical trial, I think off the top of my head was around 35,000.
That's huge.
Which is huge. You would rarely be able to get 35,000.
And you can't be biased with 35,000 people.
Yeah.
Like you can't say, okay, I only chose one particular.
From 3 or 4 different countries.
So it's so random, you know what I mean?
So, you know, that's before that. You know, that's for it to come out. And now, look, in combined, there's been over 1 billion doses. So that is huge. It's just massive. And so you would never, ever get something like that normally without a pandemic like this. So that is the ultimate test of
So
the
would you say a
vaccine
pandemic
and the
is actually a good scenario for testing?
when you're testing a vaccine, of course.
'Cause
Because imagine there was no pandemic. How are you going to find enough people to be exposed to the virus to be able to test them?
Yeah.
You can't test them where there's no virus because you're
have
not
to be
going to
sick,
get proper
yeah.
results.
The
Because
virus has to be floating around to know if it works.
yeah, exactly. So it actually works that doing it I'll say quickly in inverted commas here, because it's been perceived as quick, and yes, it has been quick for the development of these. But one, there's been a need, and two, this is when you need to test it.
Well, don't forget, it's actually
And in the first trials, the results were amazing. So if the results were no good, and there's been 4 or 5 vaccines that have not made it to market because they just didn't work. So there has been failures. It's not as if that's it. Whoever wants one is getting one. There has been failures. People are doing tests.
but you have worldwide sharing of information.
Of course, and that doesn't normally happen. There's everyone sharing information. That doesn't normally happen. There's governments sharing information.
Everyone normally holds secrets now.
Yeah, there's actually companies sharing information between themselves, and they're the biggest of enemies. So it's something that's it's happened, and it's been really it's really a lot of collaboration.
You hear a lot. It's very common. Blood clot.
Yes.
Just to
So let's tackle the AstraZeneca vaccine. Yes, there's something. It's a condition called TTS. I'm going to call it TTS because it's a really long name, but it's thrombosis with thrombocytopenia syndrome. So basically means it's clotting and bleeding at the same time. That's what it basically means. The thrombocytopenia means that you've got less platelets, and the platelets are the ones that clot, but the thrombosis is a clot. So it's a bit confusing for people. It's like, oh, what? You're getting both. So it's like a clotting disease, a clotting syndrome. Okay, so it has been identified as a probable risk of the AstraZeneca vaccine, as well as the Johnson & Johnson vaccine, which isn't in Australia, but which is similar. And it's not a risk with the Pfizer vaccine. It doesn't have any significance to the Pfizer vaccine. So it just seems to be the AstraZeneca vaccine. But I want to put into perspective. So what's the risk? In the current Australian data, the estimates are the risk of developing it is 2 to 3 cases in every 100,000 people following the vaccine. So it's also more frequent on the first dose. So if it's going to happen, it generally happens on the first dose. And the risk of it happening on the second dose is 1.7 cases per 1 million doses.
So really, you're talking maybe when the Australian population is vaccinated, talking possibly 400 or so cases of this.
Cases, yes.
Yeah, and you're more chance of something falling on your head when you're walking in the street than
or a car accident.
Like it's so small.
Yes.
And with everything, I guess there's calculated risks involved.
Of course. There's
and you mentioned like Lipitor being one of the most popular drugs, and it saved millions of people, but I would assume there would have been 1 or 2 or 3 people every 100,000 that would have had a reaction or possibly death.
There was. They had issues with a muscle condition in the legs, muscle dystrophy in the legs. So that was something that happened to people. But again, the risks and the risk versus the reward was not even a question with Lipitor. So
just with every medication, there's always going to be people that their body responds differently, and there's no way of ever knowing that. It could be someone that's actually very sick, and it could be someone that could be fairly healthy.
Yes.
And in saying that, some people don't take any medication and end up getting clots.
Well, there's 50 clotting episodes per week in Australia. People are rocking up to hospital or doctors with clots, 50 a week. So that's, But this is look, I'm not going to try to pretend it doesn't happen. It does happen. It can happen. It's not very common whatsoever when we're talking about 2 or 3 per 100 cases. And that's the, for the actual clotting.
Well,
now, when we come to death, that's a different story.
At the back of, so that's 1 to 2 per 100,000, not death.
That's not death.
That's just that condition.
Yeah, the
So
condition.
it could
And
be
it's
1 in a
treatable.
million a death. You don't.
It's actually, I have got it later, but we'll get to it now. Death from this TTS with AstraZeneca. So far in Australia, there's been 6 and there's been 6.1 million doses administered as of last week. So 6 deaths in 6.1 million doses of the AstraZeneca vaccine. So look,
he has 0.00009%.
Yes. It's really small, but look, they are still deaths and people still worry about it. I get it. So that's why, and again, we're talking, that risk is for under 60 years old.
Yeah.
Over 60, it's a little bit.
Just a quick, like a lot of the medications that you buy, sometimes on the packet it says warning signs.
Of course.
And it actually always mentions may cause unconsciousness, may cause breathing problem, may cause death.
Yes.
And we don't get shocked.
No.
Because we accept that, it's being it's sold at a pharmacy.
Yeah.
A lot of people have taken it.
Yeah.
There could be that odd occasion. We've heard stories of people eating watermelon and passing away because they had a reaction.
Yeah.
Yellow watermelon, there's a disease sometimes it can have.
Yeah.
Like it's a risk that's so small. I don't know if you would call it even a risk, but something that can occur. But it occurs on all levels of life anyway.
Of course.
Yes.
Yes. 100%.
You know what they say? You shouldn't make too much noise in a pharmacy.
Why?
So you don't wake up the sleeping pills. I chuck one.
That's a good one. Oh, I've never heard that one before.
There you go. There's a new one there.
Yeah, there you go. Excellent. Well, so also just to go over a little bit more, there's no it's a special type of clot that the virus may cause.
Like it's identified to be related to that virus.
Yes,
okay.
Correct. Because it's like an immune response clot. It's a little bit technical, but anyway, that's just that. So it doesn't give you. So the AstraZeneca vaccine doesn't make you more susceptible to any other type of clot like deep vein thrombosis or heart attacks or strokes or anything like. Doesn't do any of that. It's just what they call immune response type of condition with that one. So, like I said, it's more prominent in less than 60 years old, and there's so no. And if you've had a history of clots, family history of clots, heart attack or stroke, or you're even on blood thinning medication, you can still have AstraZeneca vaccine. It doesn't affect any of those type of things.
So with that, like we said, 0.00009%.
Yes.
Very uncommon. Some of the symptoms is headaches, abdominal pain, chest pains.
Yeah. So they're the things, and they come from about 4 to 30 days after the vaccine. It's not an immediate thing.
Yeah.
So 4 to 30 days after the vaccine, look, the main things are if you get a persistent headache that doesn't go away when you're taking Panadol and Nurofen, abdominal pain, leg pain with swelling, or difficulty breathing with chest pain, then that's when you need to, just go to the doctor. If you do have any of that and you get to the doctor early or the hospital early, then you will find that that it doesn't. It's treatable. It's treatable. So also, as I was saying, that so there's out of this TTS, there's been 87 cases from the 6.1 million doses. With 6 deaths. So overall, that's again that's 0.0014% of the TTS clotting episode with the AstraZeneca in Australia. So again, quite low.
There's
quite low.
just a comment from my brother. I'll reward him. It's a good question. He goes, why is it needed when 99.7% of people recover from COVID?
Yeah.
We answered this before, actually. We spoke about this before.
Yeah.
And yeah, you're right. Let's say 100% recover.
Yeah.
That's not the problem.
Yeah.
Problem is, like, as we see now, a new strain comes along. Delta strain.
Yes.
The problem is not what a virus does now. It's what it does later.
Because they replicate. They mutate.
And that's the thing with history. And I advise you, brother, look at the history of the swine flu. Look at the history of other diseases. Spanish flu. Is one in particular, the big one. Fifth. When it first started, it wasn't considered to be anything until, again, it changed and you're talking between 50 to 100 million deaths. That's a flu. That would now we consider it to be nothing. And you're saying 99.7% of people recover. It's true.
The mortality rate is 2%.
But
so let's say it was
whatever it is.
But 99.7 is
whatever it is.
Let's say it's 98% because the mortality rate seems to be. But the 2% that don't recover, if you multiply that by 1 billion, that's a pretty big number.
Like I mentioned before, there's some factors that play a role. Now, yes, 99.7 whatever they recover because if you're sick, you can go to the hospital, you can get on an incubator, you can get on oxygen, you can get into ICU. But the problem now, one of the things we mentioned, when healthcare is no longer available. So let's say all these people are sick, and they go into hospital.
There's not enough room.
Yep. That's when you start having people dying. So that percentage gets lower, and the recovery rate becomes less. We're not worried about now. See, we talk about, Australia had 177 new cases today. But other countries, I think Indonesia had 80,000.
Yeah.
England had, 40,000 or something like that.
Yeah.
It's what happens later. And one thing you have to understand, viruses mutate. They change.
Yeah.
In 5 years' time, that 99.7% recovery might be 99.7% death rate. The thing is, we just don't know. Vaccine is not a treatment. Vaccine is a precaution.
It's a precaution.
A prevention.
And it's not 100. Like I said, it's not 100%. But what you're saying is exactly right. The strains that they keep mutating. Hello, Delta wasn't even around last year, and now it is. And subhanallah, viruses they change their form, so it makes it harder for the body to keep fighting it. So the longer a strain is out there, the more chance it has to mutate again, and then we start to, if we don't catch it early enough, and try to stop its mutation, then it will just keep happening.
And the brother said, again, I'll reward him, and I understand your question. It's a valid question. You know what I mean? And the thing is, you just don't know in the future. And Islam talks about treatment and prevention. And if you don't want to take the vaccine, then that's your personal choice. No one's gonna hold anyone. But those that do take it, again, it's their personal choice. And he mentioned something too about it's useless in sort of preventing. Something you have to understand about medicine, it's like someone having a fever, right? Someone having a fever, we give them Nurofen, we give them Panadol. There's actually no evidence at all that reduces a fever, at all. But we do it. And when you know that you're taking it, the body some way or another reacts and actually brings the temperature down. They call that a placebo, right? I'm not saying that works in a virus. But sometimes giving someone something gives a confidence. And it's not just about health effects, it's about an economic strain on everyone and a fear factor too.
Yeah.
So again, we're not talking about now. We want to prevent possible things that happen in the future. And you know what? I would actually think to myself that with all these brothers watch all these movies and end of days movies, all those movies they watch, it's always a little virus that changes and everyone becomes a zombie. And we're actually very interested in watching movies like that.
Yeah.
But that's the reality. That's what not everyone turns to zombies, but
I know what you mean.
A switch can be flicked, and then all of a sudden it's no longer COVID-19. It's some other strain, and that strain is just killing people left, right, and center, and it has happened in the past. It has happened to a lot of diseases.
As you know, Omar.
So Jazakallah khair, brother. Very good
Yeah.
question, but we try to cover what we can in it.
Yeah, as you know, Omar, anything is possible. Yani, who knows what the future holds? Only Allah knows what the future holds. And viruses are, a part of our life. And all these things are part of our life. But so vaccines, they help. They help, even if it's to slow the transmission of viruses. If you can never, like I said, they mutate and they change and they're not 100% effective, but they definitely slow the progression of a virus.
It's 100%.
If we had no vaccine, it would be ripping through the whole community, through the whole country, through the whole population. And look, the vaccinated countries, the ones who have,
they're going back to normal.
They've gone back to normal. They're still getting Delta strain. I mean, let's not, sugarcoat it. Yes, they still have problems in England and that, but it's not anywhere near, in terms of hospitalization and death, anywhere near what it was for them before. And that's what a vaccine can do.
So the study out of Israel is showing no double vaccinated is not protecting them from the Delta variant. That's pretty much what we're saying.
Yeah. So who said that?
Just the comments on Facebook.
Oh, okay. Well, look.
But brother,
I don't mind people's comments if they're fine.
Yeah.
But we need where they're getting their references from.
The important thing for the listeners to know is that a lot of the actual valid research articles, if you're not paying for them, you're not really getting the right stuff. To what I know, because research articles are subscription based.
Yes.
And they're the ones that give you the real core information.
Yeah.
Abstract, articles which just give you a brief, don't really give you
the snippets.
Don't give you the real information. Yeah. And it's important to know that you can't just look at one, you actually have to look at everything together. And what we're talking from a technical sense. Yeah. Hey, in theory, let's say in 1 year time, they say, the vaccine wasn't good. And that happened with polio. Polio, the first phase of vaccine actually made polio worse. Yeah. Until it was the second dose that came out that stopped it. So things are not perfect.
It's pretty evident that these vaccines are doing something positive, because we've had over 1 billion doses and they have been successful in slowing the transmission all around the world.
Sorry, even 2 people. Come on, brother. Are you serious? Even the 2 people who died out of 100, their lives matters. All right, so we stop Hajj because people die at Hajj because they get stopped, they get stampeded on. Come on, bro, wake up to yourself, brother. Honestly, even the 2 people who died out of the 100, their lives matters. Of course, their life matters.
Yes,
but do we choose who those 2 people are? Don't drive a car, akhi. Don't drive. Stay at home, because everything you do is a risk.
Look, those 2 people. I understand what he's saying, and we're not dismissing that.
No, it's just out of ignorance.
What we have to remember, brother, is that I think in the last outbreak here, we've got 11 people who have died so far just in New South Wales. So their lives matter as well, just like the other 2. Everyone's lives matter, but there's going to be risks from either side. So, and the way that in medicine, the risk reward is just like that. Let's say, I don't know what the figure is of how many people have died from a vaccine all around the world. I'm sure someone might tell me, but let's say it was 6,000. I think it's 6,000 in America versus how many millions have died. So that's what we call the risk reward. How many people might die from ill effects from a vaccine versus how many people are going to die from the actual disease. That's what you got to remember.
I just don't understand, because he's saying here, Allah says in the Quran, whoever saves one person is like saving the whole of humanity. Well, this is what the vaccine's for.
The vaccine is saving more than people that are dying.
Are we saying that vaccine is there to kill people? No, we're saying it's there to save people. But there could be that odd occasion, unfortunately, that with any risk of life,
any medication.
And like I said, do you stop Hajj because people are killed every year because they get stepped on? Allah Rahman. Stampedes happen all the time. Do we say khalas? No. There's always going to be a risk. We don't want people to die. That's the obvious point. But you really have to go back in history and look at pandemics and look at things that have occurred and you realize that the only solution is a treatment, or you stay in quarantine for until it dies out itself, till it decides to die itself.
Yeah.
You take the choice.
Yeah.
And we're not saying, I don't think in any of this program at all, we didn't even say once that you have to take the vaccine.
No.
It is your personal choice.
Yeah, of course. Yeah.
We're here to give you the information about the vaccine.
Yeah.
You can make a decision what you want to do with it at the end of the day.
Yeah.
I think that's fair.
100%. Yeah. Look, and there's so much information out there via social media and things like that even from the questions I'm getting from friends and customers and patients, and so there's a need for some plain information, not from social media sources and things like that. Just plain old normal information, and people can do with it what they like. People can just so they have the information. That's all we want them to do, is have the information.
Just a couple of questions. A lot of people, there's a lot of comments. Again, Allah reward you, brothers. All the comments are very, very important. Some are just plain, not right, because it's, again, do your research, do your study. Sometimes better to keep your opinion to yourself. We do have Saeed here. He is a pharmacist. This is his field. He's only giving you this information as a point of knowledge, and it's important knowledge to know, because this is a current situation. And about vaccinated, unvaccinated, we're not hating on anyone, and we're not saying vaccinated is good and not vaccinated. We're just giving you the information. A lot of people are asking a question, and because of time, I think it's important to touch. Is they're asking in regards to the ingredients?
Yeah.
And they're asking, is there any haram ingredients that are inside the vaccine?
Yep.
And
so what's the classification of a haram ingredient then, Omar?
I would assume anything that falls underneath the Sharia as forms of blood.
Yep.
Because what's haram in Islam is that blood mainly.
Yep.
Alcohol.
Yep.
And really anything which is coming off. This again, there's a difference of opinion when it comes down to pork-based products. But let's say pork-based products for the argument's sake.
Okay. So the Pfizer, I have got the full list of the Pfizer vaccine ingredients. The first one's a bit difficult to say, so it's abbreviated as ALC0315, but I'll have a little go at it. It's 4-hydroxybutyl azidiol bishexene hexadecanoate. Woo, it's a big one. It's a very big compound. The second one is propylene glycol, a derivative of propylene glycol, which is also short for PEG. And then there's cholesterol.
The brother that wrote about the 2 people dying out of 100, he's saying in regards to support of taking the vaccine. Sorry, I must have misunderstood it wrong. I love you, brother. Please forgive me for Allah's sake. I beg your forgiveness. But still, what you said is correct. But some brothers also think the other way too. So would not take it generally, not directed at anyone. Jazakallah khair.
So cholesterol.
Yep.
Which I found interesting. Potassium chloride.
What do you mean cholesterol? They actually have cholesterol inside of it?
Yeah.
Like as fat?
Yeah, like a fat, yeah. Potassium chloride, monobasic potassium phosphate, sodium chloride, dibasic sodium phosphate dihydrate, sucrose, and water for injections.
Sucrose is sugar?
Yes.
Okay.
Yep.
Sodium chloride is salt.
Sodium chloride is salt.
Okay.
Potassium chloride is another type of salt. So the AstraZeneca vaccine.
What type of water are we talking about? Salt water, normal water?
Water for
filtered
injections. Water for injections.
Just filtered water.
It's like
it's sterilized water.
It's sterilized, yeah.
Is that halal?
I hope it's sterilized.
But sorry, just one other thing.
Yes.
These things that you mentioned,
yes.
I realize I've seen these ingredients a lot. These are basic, what they call groundwork of a lot of medications.
Yes, they're not preservatives. They're not preservatives, but they're obviously compounds that they keep the messenger RNA stable. And the Pfizer vaccine is kept at minus 70 degrees So, again, it needs some other things. With anything, you need, with all drugs and molecules, you'll need something to keep them stable. Looks like you have another question. Or you
Yeah,
just,
it says, why are many doctors, especially on YouTube, are against the vaccine? For laymen, it's scary getting different views on the same issue.
Yeah.
That's a valid point.
Yeah, it is.
There is, but in general, when something is new, there is generally a fear out there.
Look, now I'm not. I don't know which doctors they're talking about, but you have to remember something. I'm not dismissing the comment, and it's even the messaging from our own government has been a bit weird. You can take this, now you can't take it, now you can take it. I get it. It's a bit weird and scary. But look, YouTube, Facebook, TikTok, WhatsApp, anyone can call themselves a doctor. I'm not bagging anyone. I'm not saying that who you're not listening to is a doctor, but just be careful who you're listening to if they really are a doctor. And are they a doctor in the field of immunology? What's the point of you've got to, this stuff is very it's a very specialized.
Like we said, the doctor does
expertise.
something, but the microbiologist and whatever, they're the ones that pick these details and actually know what's in the vaccine. These are the right people to actually actually ask. But then again, not every medication is perfect. We've established that.
Of course. And look, people have. I'm sure there's pharmacists who don't like vaccines. I'm sure. I don't know any, but maybe I'm sure there is. Everyone's got a right to their own opinion. And it is a bit scary when you see these guys. But look, I think what you have to remember is the majority of doctors, and you'll find that the vast majority of doctors are for vaccines, and the vast majority of healthcare professionals are for vaccines. And the outlying guys, everyone's entitled to their opinion, but if the majority is with vaccines, and that's pretty much, I think that's pretty. I think everyone can agree on that.
Just sorry.
So the AstraZeneca ingredients.
So I am getting a question about Pfizer.
Sure.
So we've done the AstraZeneca.
No, I haven't done those ingredients yet. So we've got histidine.
Which one did we do?
We did the Pfizer. That was the Pfizer.
We done the Pfizer. For those that are writing comments, we did do the Pfizer one.
Yep. So the AstraZeneca, obviously the main ingredient in the Pfizer vaccine, is the messenger RNA, which is called BTN162B2 mRNA. So that's the actual the active ingredient, but they're all the other ingredients in there. The AstraZeneca vaccine has histidine, which is an amino acid, L-histidine hydrochloride, which is again the same thing but with a salt attached to it, magnesium chloride hexahydrate, which is it supports like many activities inside the cells of the body. Polysorbate 80, that's a stabilizer. Ethanol, so that is ethanol, alcohol.
But it's a chemical alcohol.
Yes, but it is ethanol. So that's, but again, there's varying opinions on. Sometimes they use it as like a solute, like to solve it to
refer back to your local sheikh about that.
Yeah, sucrose, which is sugar, sodium chloride, disodium I never know how to say this. EDTA, which is a very common binding agent that they use, and water for injections. So there's none of the vaccine ingredients of human or animal origin. There's food or latex or gelatin.
So in the COVID-19 in the vaccine, there's no ingredients of human, fetus, animal, anything like that.
Nothing. Latex or gelatin of any of the vaccines.
All right, so because a lot of questions are asked about halal ingredients. So what we know is that there's nothing that what we can see here except for ethanol, which is a common derivative ingredient in majority of the medications.
Heaps.
And there is
especially liquids because it dissolves really well.
Yeah, and I do remember
compounds
that there is a lot of fatwa and fatwa committees in regards to
Yep.
some of these ingredients
Yep.
and especially in ethanol. So again, this is not a Sharia or a fiqh lesson,
Yep.
but you can refer back to that.
Yep.
The question is that if there is a risk, isn't haram to take. You cannot put things into your body that will harm you and you don't know what is in them. It's true. You can't put things in your body
Yep.
that can harm you. But in one way or another, a lot of things we do have harm. And this is where the general principle of Islam comes, that if there's and Allah subhanahu wa ta'ala tells us about alcohol, فيهما إثم كثير ومنافع للناس, as that alcohol has a benefit
Right.
for people. However, the harm outweighs the benefit.
Correct. Yeah.
So there's never going to be 100% good and 0 bad or 100% bad. It's always going to be, even alcohol, Allah subhanahu wa ta'ala is saying there's some benefit. However, the harm outweighs the benefit. That's why it's prohibited. With medications, with anything, food, drink, Coke, soda, whatever it may be,
Yes.
if the harm outweighs the benefit, then you avoid it. But if the benefit far outweighs the small possibility of harm, then you're allowed to take obviously the benefit.
Yeah.
And again, we mentioned that the scholars have spoken about not just vaccines, medication in general.
Yep.
And a big one is like chemo, for example.
Yeah.
If someone has cancer, without a doubt, there's a lot of harm.
Well, it kills your own cells.
And it does a lot of damage. But if someone were to take that I might have the benefit of curing this disease and living, and that he makes that ijtihad himself, so I think this will benefit me more, then that comes back to him. And obviously he doesn't do that on his own consultation too. He asks the people of knowledge and ilm. But that's a good question, brother. Allah make it easy for you. So that's the ingredients of the Pfizer, of the AstraZeneca.
So that's the full ingredient list for both of them from their product information.
So, and like we said, they come in two different ways or two different forms. I'd like to remind the listeners, you are tuned into the Pharmacy Hour with Saeed Al-Khodary, which is a pharmacist, and you're joined by Omar and Najjarine, as most probably would have heard the morning program and the youth programs. And at the same time, we want to underline, what do they call it? Disclaimer, that we're not telling people to take the vaccine. We don't even know. So it could be an anti-vaccinator. We don't know. I might be an anti-vaccinator too, but we're giving a non-biased information for you to have all the knowledge.
Yes, of course.
And Islamically, we mentioned from the beginning that in Islam, no one can force you to have treatment. Yeah. It's up to your choice, but base your information at least on knowledge rather than just because Pete Evans says. This is something that I dislike because hippie says. Based on proper knowledge.
Someone sent through a question earlier in the day, I think, about these videos on TikTok about people after they've had their vaccine, they've been able to put magnets on their arm.
Yeah.
Have you seen that?
Yeah, I've seen that, and about a UV light. And
I haven't seen. I didn't know. I hadn't seen. I didn't know what they were talking about, but I had a look at it, and yes, there was something. And I also saw an interview with one of the people who stuck a magnet on their arm. With the BBC. We got to try it. We got a demo in the. No, not working.
Not working.
No.
He took the vaccine, and I was not working.
It's not working for me either.
You're turning a bit green, but
so I did see a BBC interview from a few days ago. They interviewed one of these girls who put a magnet on her arm where she had the vaccine on TikTok and got millions of views. And they interviewed her, and she then admitted that yes, she had licked the magnet before she put it on her arm before the video was shown, and it stuck to her body. So just be careful. I'm not saying everything's incorrect, but just be careful. You know what you see sometimes. It's not always what you think it is sometimes.
SubhanAllah. We've got a lot of information, but like I said, we've only got so much time.
Yes.
Can we go to frequently asked questions?
Yeah, yes, for sure. Yeah,
The
for
reason
sure.
I asked those questions is because they were being asked live,
Yes,
and
yeah,
so we
no
don't get
problem.
lost. So we're chucking them out.
Is there any more?
There is one more. Again, sometimes people they type, especially on their phones, the message doesn't
Omar?
get across.
Omar, there's
What?
there's another one.
All right, I'll look at it. It says Pfizer has peak, so isn't it permissible? We went through the ingredients. We did say that.
No, there's no. As far as I can tell from there's no pork products or anything in there. So
Do you recommend that we wait for the Pfizer or take the AstraZeneca? From the pharmacist's point of.
Yes. Okay. This is probably the most common question I've been getting from everyone, and I'm going to assume this person is under 60 years old, under 40 years old, or around that age, or
Got a picture of a
less.
car, so I'll assume
Yeah, Rotary.
It looks like a BMW.
Oh, nice. So what I would say is you weigh up your risk reward. Now, we've stated the risk is really small for the blood clotting issue, the TTS. So depending on your tolerance of risk, you may think, well, I can handle, a 0.0095% chance of something happening. Or if you don't want to risk that, then you look at how badly or do you need it quickly, because it's going to be a few months before the Pfizer vaccine's available to mostly everyone, like about 2 to 3 months. So you need to look at each individual need to look at, okay, how do I hang around a lot of elderly people, like my parents? Am I going to put them at risk? Or do I use public transport a lot and, there's a lot of people on there? Or do I have someone at home who's immunocompromised? So someone who's on like medication that makes their immune system low, whether it's your wife or your husband or your brother or your sister or your parents. So if you're in contact with a lot of those people, I would say, okay, go the Astra. If you're not, then you can wait. Or if you have a higher tolerance to risk, and by that I mean, it's still a very low risk. Remember, 6 deaths in 6.1 million doses in Australia, and even, only 87 cases of anything with regard to clotting in the 6.1 million doses so far. So if you have a higher tolerance to risk, then you can go for it.
Someone posted the Israeli study.
Yes.
Since when did we take things from Israel? Well,
that's okay. What's the that's a long
article. Got to look into it.
So what I've what I've heard from the Israeli study, because they were one of the first to get vaccinated, is that the Delta strain has it's only been about 40% effective for them. This is from what I've heard. So I mind you, I haven't looked at that. I'm not sure what's on there, but from what I've heard, it's 40%, and that's generally because they started very early. So now they pretty much got done, really early, and they had limited time between their booster. Whereas, if you extend the time between the booster, you get more coverage.
Yeah. I just want to say, like, in generally with the Muslims, one thing you have to understand with studies is that some countries are known to be more, more stronger in their research articles, in their research studies. Like, I remember I was told, like, European studies, British studies are known to be like among the best studies in the world because their criteria is different.
Right,
we don't know. Well, if I tell you statistics about Israel reported this, Israel reported that, tell you, Habibi, don't take nothing from them. When we're taking things from them, I think we better wait for stronger studies to come out, because that's the reality of it.
Yeah.
And you're talking about a country that's known to muck around with figures all the time.
Yeah.
You know what I mean?
Well, look, I mean, like we said, it's, we're not trying to, I'm not trying to say that vaccines are the answer and that's it. A vaccine is going to fix the world, as they say. But it just helps to spread. It helps lower hospitalizations, lower deaths, and that kind of thing. So that's what we need to think about, you know,
and
those kind of things.
And you got to look at one thing too, that Israel might be posting this to try to show the world that maybe the way we've done it, there's a better way of doing it. This is what a lot of people don't understand with research articles, is that reason that you publish them to is that to show the people, okay, this is what we've done.
Yeah.
Don't repeat what we've done, because it hasn't necessarily worked.
Look, you know, we have to look at for the brother who posted that, and like, again, thanks for doing it. But what we're trying to think of two scenarios, with a vaccine and without a vaccine. That's all. You know, if the vaccine's not, you know, 1,000,000% effective, you know, that's okay. It's no vaccine versus with vaccine. So no vaccine.
You know, we say it's like
we're getting millions of deaths, and they're happening. They're all around the world. We know that. It's before, at the start, people were saying, "Oh, it's fake," but then all of a sudden we realized that, you know what, people are getting it, because we started to see people that we know get it.
You know what I said, but it's just I guess it just comes back to a mentality type thing. Because, like I said, if you don't want to take it, don't take it. And if you want to take it, take it. We're not saying either way, but you know, your neighbor drinks alcohol. That's his business, bro. It's his home. It's his issue. Yeah. He's on drugs. Who cares, bro? Oh, he got vaccinated. Yani, we're turning on those that have chosen to get the vaccine, or have their children take the vaccine. And I consider that to be wrong. Because there are so many things out there that is actually wrong, without a doubt, from Allah subhanahu wa ta'ala, that you have no problems with. But if, for example, someone, you hear that he's vaccinated, all of a sudden you get like this. Why? Because the perception that's made is he's going against, I don't know, human nature, or he's going with the government, or a lot of people are saying, you know what, I'm just going to wait it out and see what happens. Yeah. And then I'll make a decision later. That's fine. That could be a sensible decision. Yeah.
Look, a lot of people have said that, and again, because it's been, the turnaround for the vaccine has been so quick. But as we mentioned earlier, this last year has been the ultimate clinical trial, with over 1 billion doses given. That's, you're not going to get any more real world experience than that.
And brother says, where's the proof that it stops the spread? If you want to talk about vaccines in general, refer to the World Health Organization papers. I think it's 2001 they published, and then 2009 they published. There's certain publications where they looked at, like we said, infective diseases around the world, and what this vaccines has done, and how it's changed numbers. That will give you a little bit of an idea. In regards to this, like we said, only in beginning phases. Yeah. But Saeed did mention that there has been 1 billion people that have been vaccinated.
And you know, death rates, mortality, hospitalizations, all are down.
Yeah. So that's,
you know, we can nitpick about all sorts of things.
But if you want to talk about real evidence, where we talk about evidence-based, this takes years of different researchers, and then someone comes and puts them all together, and they do what they call a review. Yeah. And then that sort of forms to be what they call the gold standard, or evidence-based. But that doesn't happen now.
It's early.
Later.
It's early, and
it's too early.
You know, it's early,
but it's promising. We say promising. We use the word promising.
Yeah, it is promising.
We don't say proof. We say it's promising.
Yeah, it's promising. 100%. You know, there can be, you know, it's definitely promising, and it's, you know, but like we said, if you don't get it in time, then it mutates. So the more mutations, some mutations are worse than others, and we've seen this with the Delta.
Someone's asking, Said, if they can have a list of the ingredients.
Yeah, we can post it up.
We can post that.
Actually, why don't you post? It's very easy. Just Google.
It might be misinformation, but the actual
I can.
Or the link of the pamphlet.
I've got the PDF, so we'll post it up. I've got the PDF for both.
Inshallah.
For both of them, and we'll post it up on, I don't know, on the Facebook page or something?
Hello, the brothers, inshallah.
We'll post it up for you, inshallah.
We'll organise that.
Problem.
But please, if you're going to be strict about ingredients in this, you got to be strict about everything. You can't just say, oh, this. You know, if you're that person that likes to look into ingredients and everything, alhamdulillah, you're doing the right thing.
I'll post the full CMI, so that's the consumer medical, the consumer medical information.
Yeah.
I'll post it on there, and at the bottom of that has all the ingredients of both vaccines for you. So the Pfizer vaccine is actually called Comirnaty.
Brother did mention, sorry, because there was a bit of information. Again, brother is contributing, Allah reward him. He said about the Pfizer, about risk of heart inflammation,
Yes.
myocarditis. Yeah, they did report in teens that was
Yes.
occurring.
Yeah.
We should use the platform informing our brothers and sisters about. Yeah. And this is something that, again, when you take the vaccine, you are like it's a medication, so you are told about the side effects. So
we have the side effects here for people. So we have time, yeah. So I have got that down that we're going to get to, brother. So you want to do that now, Omar? Or?
Well, we're into questions. These are live questions.
So anyway, I will. So Pfizer, the serious side effect, if you like, from Pfizer, or the more serious side effect from Pfizer, the Pfizer vaccine or the mRNA vaccines in general, is myocarditis and pericarditis. So, which is basically like an inflammation of the heart muscle or the lining of the heart muscle. So it hasn't been 100% established, but it's very suspected. So they suspect that it is because of these vaccines.
And if it is, are we talking about very low percentage?
Yeah, so very rare, and it normally occurs about within 14 days of vaccination. So particularly after the second dose, and it's more often in younger men. So most cases are what we call transient, and they just resolve after you have a bit of rest. Some do need treatment in hospital, not a lot, but some would need treatment. So the TGA, which is the Therapeutic Goods Administration of Australia,
for those that don't know,
they're really
very
strict. So they're monitoring this. So they're monitoring the TTS from AstraZeneca, and
if they do find anything, the smallest amount of
it's on their watch list.
They would
it's been
stop
happening
straight away.
It's been happening. So there's been a few cases already, and they're working with the international regulators as well and reviewing all the medical data from all the countries. So this is what the TGA does. So up until the 18th of July, this year, obviously, 18th of July in Australia, there's been 66 cases of this.
From the Pfizer.
And that's from the 4 million doses that have been taken. And there's been no deaths from it. Just 66 cases.
So they've had a side effect, but they've recovered.
Inflamed of the heart, most recover by themselves without the hospital. And so it causes like an inflammation of the heart muscle or the lining. So, you might get a bit of like slow heartbeat, chest pains, and that kind of thing. But again, resolves itself normally.
I think I remember when I doing my...
That's the Australian numbers, by the way.
Yeah. When I was doing because I've done my endorsement for scheduled medicine.
Yeah.
And even the simplest like antibiotic, Keflex, which is a very common one.
Yeah.
And we're going through the list of side effects. Some of them sounded horrendous.
Yeah. Yeah. There's
bleeding and this and that. Like, they're all possibilities.
Of course.
They're all possibilities. And we're not saying that there's going to be... But the good thing is at least that we can link it to the vaccine and say, okay, now we know that the vaccine causes 1, 2, 3. That makes us look out more for the symptoms.
For the symptoms, yeah.
Totally.
And they're treatable, so...
And they're treatable. So they give them medications.
Yeah, there's treatments for them.
Anti-inflammatories and things like that.
There's treatments for them. So it's not something that, like we said, they're treatable. And again, I'll say it again, it's risk-reward, It's risk-reward.
Question, Moderna. Is it any news about Moderna coming to Australia and about Novavax?
So the Moderna...
Moderna's asking about, is it coming to Australia?
Yep.
And the other one is, the Novavax is it the same as, does it use the new mRNA?
mRNA. Okay, so Moderna is a mRNA, so that's like Pfizer. And that is coming to Australia. I don't know when though, but it is on the way. The Novavax, I'm not sure if it's a messenger RNA, but I'm pretty certain it is. I don't know though if Australia has got any of that on order. But yeah, I can find out for you if it's a messenger RNA. I'm pretty sure it is though. The other adenovirus vaccine, so similar to the AstraZeneca one, is the Johnson & Johnson vaccine.
It says, since you said the ingredients aren't harmful, how do chemicals that aren't harmful cause these adverse effects? It's because even peanuts is not harmful, but it can cause adverse reaction.
Yeah, anything you put into your body it can cause an adverse reaction.
Yeah. And like I said,
something natural or something unnatural.
Even I know people that have allergies to fruits and vegetables. I had one guy, his allergy was, if he had it, he would tell me that he would possibly deaf. It's a cucumber. He's allergic to cucumber.
Yeah, well, like you said, there's peanuts and other things. So, I mean, look, anything can...
And they're from the halal. They're from the things that are more than halal. So sometimes an extract or certain type of ingredient, it just happens to be that the way the body is, it has a reaction to. And unfortunately, there's, it's just the way it is. There's no explanation for it.
Yeah.
Someone said, why do you think about the Israel? Who do you think funds Israel? You said conspiracies now and theories and going into details and whatever.
Look,
what makes the US studies any more honest than theirs? There is a difference and there isn't a difference. So we just went through the assault of Palestine and Israel and lying about numbers and all this other stuff, right? Yes, we want to talk about their supporters and who supports them, all this other stuff. I'm just saying is that we take things like that with a pinch of salt. That's all we're saying. And we say that Allah subhanahu wa ta'ala warned us about the Yahud. It's a direct warning about the Yahud. And in general, if a first comes to you with information or news, then verify it. And we didn't say base everything on America only. No, we didn't say that either. We're saying the whole world is coming together.
Yeah.
And the whole world.
It just so happens that two of the biggest companies bringing out, AstraZeneca is a British company, and the Pfizer. Although the Pfizer is a conjunction, was made really in tandem with BioNTech, who is a German company. So it's called Pfizer, but it's really a Pfizer. It's Pfizer BioNTech. So the people who did the main research is BioNTech. They're a German biotech company.
Listen, the whole world now is getting involved. But I was particularly talking about one research paper that came out of one place, out of one country, one institute. That's what we're referring to. But if you come with a collectively, and they're part of a collective network around the world, which those that understand articles and how they work, and that's the way it should work, and that's what you call evidence-based proof or review. But anyway, good point, sister. I respect your
look.
Your comment.
And so it's also we got to remember that yes, people are worried about long-term studies, and we haven't had long-term studies because it's only been here for a year or so. So we're not going to get any long-term studies out of it. But like I said, we've had over 1 billion doses and rising. So a lot of people would have known other people who have got the vaccine and completely nothing wrong with them. I know, my family members have had some, my uncles and aunties and friends and people have been having it without any issue.
Another comment from sister: 45,000 deaths confirmed within 3 days due to the vaccine in the US. How do you explain that? They filed a lawsuit against the government.
I know exactly what she's talking about because someone sent me a TikTok of two guys saying that. And sister, just verify what you're viewing, because half the time it's not true. I saw that. It was a TikTok of two guys who I don't even know who they were, but anyone can go up and say, there's 45,000 people die. Please, guys, we've got to think about what we're seeing sometimes. Just verify your information. I saw that exact video.
I think
someone showed it to me.
People get shocked. I guarantee if there's 45,000, if you knew how the health system works in a lot of the countries in the world,
they wouldn't be able to handle 45,000 deaths.
If 45,000 people died
in 3 days,
they would have put us it would have been a big. No, then they said they sued the government. I mean, the government will put a stop to it straight away, so they don't be sued. And it is a lot. Like I said, there is a lot of misinformation. There is, and you know what? A lot of it is done purposely to boost up a certain. Because what happens, and you find this a lot, and unfortunately, it's very sad. And you found a lot of people with the anti-cancer treatment type, like chemo is not good. Chemo is not good. And it's not. It is terrible to go through chemo, but then they'll come and they'll say, "Oh, but we have a herbal solution. Come buy a herbal solution. We got a herbal way." And you find that's being promoted now. Or at least, in some countries around the world, they're taking certain herbs and being like in third world countries, people are spending all their money to buy these herbs to protect them from COVID. So there's always agenda from both sides. That's why I said, take all the information. I always advise, speak to your doctor, the one that you trust, your sheikh for clarification. And at the end of the day, whatever decision you make, pray istikhara and Allah. Assalamu alaikum. Is there any deaths reported post Pfizer vaccine? I think you said in Australia there isn't.
In Australia, I can't find any in Australia.
But they may be in the future. Don't be surprised.
In Australia, from what I can tell, there's none. Yeah, none that I've heard of, and none when I've researched. Up until the 18th of July, there was none.
18th of July.
18th of July.
Yeah.
That last
I don't think that I've heard any either.
Yeah. So only those 66 cases of the of that inflamed heart muscle. Now, look, there's definitely some common side effects. I'll go through them really quickly because these are the things that are pretty common. I'll give you some percentages. For Pfizer, pain at the site of injection, 84% of people get that. Tiredness, 62% of people. Headache, 52% of people. Muscle pain, 37% of people. Chills, 35% of people. Joint pain, 22% of people. Fever, 16% of people. Diarrhea, 10% of people. And with the Pfizer vaccine, they last maybe 1 to 2 days max normally, if you get it. And it's with Pfizer, it's more common on the second dose rather than the first dose, which is pretty interesting. The AstraZeneca vaccine, the common side effects normally again after 1 to 2 days or last for 1 to 2 days. Tenderness at the injection site, about 64% of people. Pain at the injection site, 54%. Headache, 53%. Tiredness, 53%. Muscle pain, 44%. Just feeling unwell, 44%. Chills, 32%. Nausea, 22%. And fever, 8%. And with the AstraZeneca, the second dose, rarely, much less incidence of those common side effects.
There's a lot of important information you've got here. And,
look, I've got a lot there. I just, I know we don't have a lot of time.
Maybe we need a round two. Because there's things like, are there microchips in the vaccine? Obviously, there isn't.
No.
There's some good information here.
There is, I think, just quickly, I think people ask, how long does it take to get some benefit from the vaccine? So how long do they take to work? So you'll start to get a partial protection after 12 days of the Pfizer vaccine. So after 12 days, you start to have some protection off the first one. Full immunity doesn't come, full protection from it doesn't come until the second dose. So you have to have your second dose for both of them. Yeah. Without it, you're going to get very, very limited immunity. 12 days for the Pfizer vaccine to start the immune, to get some protection, and 22 days after the AstraZeneca vaccine before you get some protection.
Les, there's a lot of information. Again, I want to make a disclaimer.
Pregnant women or looking to get pregnant or anything like that.
I know with some medications,
the Pfizer vaccine is recommended, not AstraZeneca. There's no studies done on AstraZeneca.
Yeah, they're very cautious when it comes to pregnancy sometimes.
Yeah, but they've done a clinical trial with pregnant women, over 30,000 pregnant women. Yeah. So
I think at the end of the day, what we're reading here is the same as language as any medication. We could be talking about any meds with the side effect, with the percentages, with everything like that. Yeah. I think the only difference with these vaccines is that it's probably the first time it's done on this global scale of sharing information.
Yes. And all done at the same time.
It's all done at the same time.
All around the world, yeah.
And there's test subjects everywhere you go.
Yeah.
because you're not just testing people that have the virus, you're testing people not to get the virus. So that could be really anyone's a test subject rather than someone that meets certain
Correct.
criteria
Yes, that's exactly right,
and conditions. At the end of the day, I know that a lot of Muslims are very concerned about the halal and haram aspect of it. I wish a lot of Muslims were like that in regards to other things too. But if that's what's really sort of getting to you and you're really into some people really into the ingredients. I remember there used to be a guy, they used to call him the halal man because he used to tell people the ingredients, what's halal, what's haram. After a while they call him the haram man because everything was everything had possible gelatin, possible pig. But like, bro, you call you halal man to tell us what's halal. No,
Everything's haram.
everything's haram. But yeah, if that's you want to get into that detail, then that's fine. And if you're not comfortable taking something, don't take it. But I guess the real message across is if someone does decide to take the vaccine, he shouldn't be looked upon like, people hating on him, like, why are you taking the vaccine? Or it's a conspiracy. Or he's chosen to do that. And he's done it obviously through, medical information. And the reality is that the majority of any medication that we take, this is actually like quite mild of risks.
It's not very, the risks are quite low. Given the risk of what we're up against, if you had, we saw what happened overseas.
In Australia, we haven't had a full-blown outbreak yet.
Yeah, if we saw what happened, and look at next door, Indonesia, they've got massive issues, and our population is small as well. Don't forget, so we're only 20 million people versus countries of 300 million. So, whilst the numbers look small here, they're still significant for us in terms of cases and in terms of deaths. But just this one outbreak now.
It could
in
just
New
keep going
South Wales,
up, you don't know.
But this one outbreak now in New South Wales where we've had 11 deaths, maybe? I can't remember if I haven't watched the news for a couple of days.
About that, yeah.
That's already more than the AstraZeneca deaths from...
I think people don't understand is that Australia hasn't had a full-blown outbreak like in the UK, like in India, like in currently in Indonesia.
Like you mentioned, we haven't had the strain on the health system. And if we just let it run rampant crazily, then it would more than likely put.
Let me tell you stories I'm hearing from Indonesia from people like brothers that we know there.
You've heard stories from Lebanon and all these kind of places.
The hospitals have locked the door, put security guards at the front. No one's allowed in.
Really?
The hospital cannot take any more people.
Yeah.
We're talking about a hospital that maybe only has 5 ventilators. Like we went to hospitals that didn't had one oven for babies, incubators, one incubator.
Right, yeah.
And they would share it between kids. Babies had 3 or 4, they would share them like 4 hours a day in an incubator.
Yeah.
So it's supposed to be in there the whole time.
Yeah.
They're closed. Doctors have shut, they're scared. They've shut their doors. They've chained up their doors. That's it. They're not taking any more patients. And people getting sick, it's not necessarily the disease. You got to look at other things. Someone's sick, he can't get up, he can't eat. Dehydration kicks in.
Yeah.
Other sicknesses kick in. For those that don't know, it's not necessarily the virus that can kill a person, but the fluid in the lungs that causes bacterial infections.
Yeah, they mostly die of pneumonia.
Pneumonia. It's not necessarily direct.
Yeah.
The virus kills you. It's the reaction of the body to the virus and building the pneumonia and other complications that can kill someone.
Yeah.
This is what we say, like a full outbreak, and then what happens and what's happening overseas is that people still try to find somewhere to go. And what they do, they cram up themselves in, halls or schools or holding facilities or whatever. So then you got the issue again of hygiene, you got the issue of sanitation, you got the issue of cramped areas. So what happens is like it just erupts the virus. It just rages it.
Yep.
And then it just starts spreading like crazy. And then it just, like the flu now is for us is a runny nose. Once upon a time, it was just wiping out people.
And what we have to remember is we're in a global world now. So we're in a connected global world. So, what's happening overseas affects us because invariably it gets to our shores. That's it. That's what's going to happen. Like, it's what's happening overseas is very important because it's, it gets into especially once the country opens up, it's going to be around. So, and like I said, you want to go to Hajj, you're going to have to get it done.
A lot of brothers had the vaccine and they went. No one because it wasn't a hot topic. They
No,
took it,
I'm saying
and
when
they
you
went.
want to go to Hajj, you don't care. You just do what you have to.
But it's going to come to a point where you can't travel without the vaccine. You can't work possibly without the vaccine. So then you have to sit back now and think to yourself, okay, if you don't want to take it, it's fine. You're choosing to live in a country like this. You either got two options. You can't pack up and leave because you need the vaccine anyway. But go and live up in a cave by yourself somewhere.
Yeah.
What options do you have? And you're not just facing this with the vaccine. You're facing it with everything, really. That's how life is. And like I said, if you choose not to take it, Allah reward you. And if you choose to take it, Allah reward you. You don't need you have made that decision as long as it's based on Islam and asking the people of ilm and knowledge, and you followed those paths, that's fine. Where the punishment comes in, Saeed, is like the men that during the time of the Prophet ﷺ, he had cut himself and he couldn't find Rasulullah, so he found two men.
Yeah.
And he said, what do I do? Do I make ghusl? This is a religious matter. But also it's got medical tied to it too. Because they said to him, no, you still have to make ghusl. Well, Islamically, if he's got an open wound, he doesn't have to make ghusl because it can cause infection. And the hadith says that because of the ghusl he made, the water entering the wound, he died from it.
Yeah.
Ended up dying. And the Prophet ﷺ got angry with them and he said, who told you to speak without knowledge? The problem comes in is when you're taking knowledge from someone or giving knowledge to someone with actually no knowledge.
Yeah.
And in most of us, the reality is we're learning a lot of this information. If you don't want to be vaccinated because you got informed by a doctor, by a pharmacist, by a microbiologist, someone in the field, and you saying this, so I'm going to take the ilm, then you've done Islamically, you've done the right thing.
Yeah.
But
right.
If a hippie that does not believe in Allah subhanahu wa ta'ala, that is an atheist, that doesn't know anything about this world, is coming and giving you information, you're taking it, then that's where I think you've really got to ask yourself, am I getting the information from the right person?
Yeah.
Sometimes he might guess it and it might be correct, but is it what Allah wants from me? Allah subhanahu wa ta'ala tells me to ask the people of ilm, to ask the people of knowledge. And that's the reality of it.
Yeah.
And in saying that, alhamdulillah, we have a lot of brothers in the field of medicine. We have a lot of brothers in the field of microbiology and what do they call it? Not pathology, the histology and all you can think about, subhanAllah.
Yeah.
You have uncles, aunties, relatives, people that you know.
Yeah. Yeah. Just look, just be careful of Dr. Facebook and Dr. TikTok and Dr. WhatsApp and all these. The things that I've seen, it's amazing. I just don't know how people can believe it sometimes.
Like sometimes things you read, you're like, you know what, they've got a point. Like, I can understand how people can believe that. But sometimes you read things that are like a microchip that's implanted in a virus, you inject and it tracks you. Like, come on, man. Like, there's believing and then there's...
Yeah. Look, it's, the microchipping thing, I think, people heard Bill Gates talk about digital certificates and they thought that's what it meant. But, he was talking about, giving some kind of digital record for people who have been vaccinated in third world countries because there's no, what's it called? But not a microchip in your blood. It's not even possible.
You watch too many movies.
Look, I get it. People are worried about certain things, and I'm not, discounting any of that. Just be mindful of your sources. Even when you're reading an article or a snippet that someone has sent you, be mindful that it may be cut. It's possible. It's more than possible. I've seen things that have been cut and pasted, taken out of context. All these things you've got to really think about it before you even send it on to someone else.
Can we just bring a real world example?
Yeah, of course.
All right, because it happened with me and my brother. I'm a podiatrist. My older brother's a podiatrist.
Yes.
When we went through uni, some articles were considered to be the gold.
Yeah.
But then they were abrogated by other research.
Yeah.
And obviously your brother Hamdi is also a pharmacist.
Yes, that's right. Yeah.
Wasn't there points where, for example, what he was learning at uni may have been different because of new articles, new research?
100%. Yeah.
So it's saying, Masalan, your brother was saying, oh, this is the way it is. Like, no, it's not. And like, no, look, there's new research about it. So research is actually constantly
it's changing and
upgrading.
And there's more results. And
so someone might show you something that might be old information. And we're talking about week to week, month to month.
Yeah.
Especially the and this pandemic is moving so quickly. Like this Delta strain just popped out of where? Where did it come from? It was just a month ago we never heard about it, and now it's just
India. It was the Indian
came out of India. We heard Delta. We're like, what's that? Oh, they called it the Delta strain. It became an official title.
Yeah.
So now we've got something else to worry about. So things are moving very, very quickly. And so sometimes to keep up with that information, again, speak to the people of knowledge, because obviously being a pharmacist, you're day in, day out is getting updating information.
Getting a lot of inquiries.
Live information.
Yeah.
And live updates.
And where you get the information. It's important. And I know people don't trust government websites. I know that, people are anti-government websites and things like that. But look, there's, why would the government want to, keep us locked down? It costs them more money to keep us locked down than to let us out. So
I feel the only reason we're locked down, if it's that we don't overwhelm the health system.
That's why
one of the main reasons,
and to try to stop the spread and interaction. So obviously that's why they're doing it. But like I said, people are anti-government. I get it, but you've got to get your information from reputable places. And Facebook and TikTok and WhatsApp, you just don't know where that information is coming from. You really don't. You don't know who and the classic example is the people who are putting magnets on their arms, saying that there's some kind of metal in the ingredient, so that's why the magnet's sticking, when they were licking the magnets and putting it on. This is the kind of stuff that it can do damage. You forward those things on to other people, and you're spreading misinformation. So just be careful with that stuff.
And I
that's
think,
all I can say.
And I think like you have a point as a Muslim to, if you have information, to always make sure you verify. And if you're teaching someone or giving that information, if you really don't know, like I know I get asked a lot, should I take the vaccine or take that? My answer is I don't know. Talk to your doctor.
Yeah.
I can't give you yes or no answer. Because if I say no and don't take the vaccine and you contract COVID and die tomorrow, I'm responsible. I'm Islamically responsible. I gave information without knowledge. And if I say yes and that vaccine harmed you, for example, again, I'm giving you information which is incorrect.
Yeah.
So I'm considered to be general public. You have a GP for a reason. You have your local pharmacist for a reason. These are the two best things. And you want to add the halal and haram thing, you have the sheikh too.
Yeah.
And I think the mashaykh have made it clear about most of the medications anyway. But if for further reference and comfort, you have that available too. So subhanAllah, you have those available. These are, you don't have to see. You can just call up your doctor now, telehealth, yeah?
Telehealth, yeah, you can now with the doctor.
So it's available for you from your house.
Yeah.
Ask the question, and don't worry. That's his job. His job is to answer the question. Obviously, as a pharmacist, his job to answer that. And soon, I think your pharmacist will be.
We started this week already. So.
Yeah. So again, there's no harm, and really, at the end of the day, if you don't feel comfortable, don't take it.
Yeah.
But don't spread weird, strange, unauthenticated information. That's not what a Muslim does. Saeed, jazakumullah khair.
Yakum.
It's been a hectic session. The brothers that have commented and the sisters that have commented, Allah reward you. That everything that you mentioned was very beneficial. From the positive, from the agreeing, from the criticism, from the appraising, whatever it may be, it was all beneficial. Yani, we like to hear from you. This is not just this is discussion. And
yes,
discussion is what, we may learn something too, subhanAllah.
Yeah.
So, Allah subhanahu wa ta'ala rewards you all that contributed. And if we said anything that offended you or hurt you or whatever, we apologize. It's only done for entertainment purposes. To say, Saeed, wallah, it's been an honor. I've learned a lot.
Omar.
I really appreciate it.
We'll talk to you about my foot now.
Yeah, we can discuss foot issues. We'll post some form of documentation.
I've got the consumer medical information for both the vaccines, so I will post them up, or I'll get you to post them up.
Inshallah.
We can do that straight away, can't we?
I think the brothers will organise that,
No
inshallah.
worries. We'll do that, inshallah. It should be up in the next 10 minutes, hopefully.
No worries. Wa jazakumullah khair. Wassalamu alaikum wa rahmatullahi wa barakatuh.